And I'll let you know, maybe we can take some little breaks in between and look at the chat and some questions that pop up.
Absolutely.
Please, everybody, don't be shy. Keep a pen and pad around if you have some questions or if you want to write down some notes. That's always helpful. I have some things I'm going to hold up here, and I'll put up for your notes, and we're going to have a great hour together. Hey, it's very nice to see you. Heather already introduced me, so I'm just going to get going on things in regards to today. And we're talking about hypertension. So truly, hypertension refers to high blood pressure. Okay, and I have it back here behind me. I don't know if you can see those. Okay, but regular blood pressure is 120 over 80 or below. And in regards to those numbers, like the doctor always mentions the numbers, okay? 120 over 80 is what we consider average. So the higher number, when they check your blood pressure, 120, or on whatever your number is the amount of pressure that your blood pushes out into vessels. So your blood vessels are like a garden hose. When your blood pumps out, well, the hose gets more pressure inside. So every time your heart beats and pumps out, you get that higher number. Okay, and that's your systolic pressure. The lower number in regards to blood pressure is your diastolic pressure. Okay, so your heart pumps out, we get the highest pressure, your systolic pressure, your heart relaxes and it refills. And as it refills, it lowers the pressure in your blood vessels or arterioles. Okay? So that's the lower number. Higher number when your heart's beating out, lower number when your heart's relaxing and refilling. Okay? So they base those numbers, on healthy average 20-year-old adults. And I don't know, did some healthy 20-year-old adults sign in? But otherwise, do realize that we all have different ranges in blood pressure. Okay, 120 over 80 was considered the norm or what's healthy. But perhaps you're one of the people that hold a little higher blood pressure, or maybe your blood pressure is a little lower, depending on your health, your condition, your genetics. Everybody can have different blood pressures. Okay? Since we're talking about high blood pressure, that would be above our 120 over 80. Okay, and there's on different stages of high blood pressure. So if we go up by 10 points, okay, like 130 over 90, well, maybe that's our stage 1, okay, hypertension. And hypertension means high blood pressure. Hypertension is high blood pressure. Hypotension is low blood pressure. Okay, so we're going to talk about high blood pressure today. So if our blood pressure goes up and it gets up to 130 over 90, that's kind of like stage 1 hypertension. Stage 2 would be another 10 degrees up, or 10 points up, I mean. Okay, and 10 points on that mercury thermometer thing that's on the doctor's wall, or it's kind of like digital now. But if those of you remember the mercury that went up, that's what they count. Those graduations in that mercury thermometer looking thing on the wall in the doctor's office. So if we went up another 10 points, that's in stage 2 hypertension. And then some people get even higher. And if they get higher than that, a lot of times those different higher blood pressures can start to cause us problems in our body. Okay. So truly, if these are our blood vessels, okay, blood's flowing along in here, well, the pressure that's pushing on the vessels is what's caused blood pressure. And different things that we do, whether we exercise, depending on our diet, maybe what we eat. Some of us have different habits, some of us smoke and stuff like that. But different things could put different pressure along the walls of the blood vessel. Okay, and those are just different cells under there. All right, and if they got a lot of pressure, they get strained. Okay, or depending on our diet, well, maybe the blood vessels aren't as responsive, and maybe they can't open and flow as easily when our heart pumps. Okay, and we'll talk about that. But in regards to hypertension, I started talking about high blood pressure. Probably about 1 in 3 Americans, and North Americans, U.S. Americans, stuff like that, have high blood pressure. And if you belong to the Kirby Center, okay, or Unison there, well, we I work with a lot of people 50 years old and up. So truly 55 years old and up, probably 90% of people are susceptible, okay, which just means that you're at risk to have high blood pressure. Doesn't mean that you're going to have high blood pressure or any concerns of it, but over age of 55, 90% of people are actually susceptible to having high blood pressure. Okay. And high blood pressure, could be caused by different things. Okay, we're going to talk about a lot of things in regards to diet or exercise, things that we can do to help. But do realize that there's some things, like in our life that could not change our risk at high blood pressure. Okay, you mentioned age. Okay, I mentioned over 50, 55 years old, we're at more risk for higher blood pressure. So we can't change our age. Okay, that's a risk factor that is always going to be there. Okay, but there's different things with diet and exercise that we can actually change. Okay. If we have high blood pressure, I will let you know that could lead us to different things. Coronary artery disease. Okay, anything coronary involves your heart. Okay, it could lead to chronic kidney disease. Okay, kidneys are organs that a lot of times control the amount of fluid within your body. So if we have any kidney concerns, sometimes that affects the amount of fluid or blood pressure within your body. And some people have different heart diseases or different diseases that specifically are in regards to blood pressure. Okay? We do realize that even though we may be susceptible to different types of high blood pressures, doesn't mean that we have to fall into that category. There could be things that we do, diet, exercise. We'll talk about a few things. Maybe we've got to see the doctor. That maybe we perhaps have to worry about diseases or different things caused by high blood pressure. Okay. All right. So I'm going to talk about two different types of blood pressure. Okay. So there's primary and secondary hypertension. So primary hypertension has no clear cause. Okay, maybe we're just getting older. Maybe our blood vessels are changing as we age. Okay, maybe there's nothing specific. I don't have anything in my genetics. Okay, and that could be a primary cause for hypertension. Secondary causes of hypertension, well, that affects about 10% of the people. 10%? 10% of the people that have high blood pressure. And they already have some underlying cause, whether it be genetics, maybe they have different things in their body and their health. Okay. Maybe they have arterial sclerosis. Okay. We might as well talk about that since I mentioned it. But arterial sclerosis is the hardening of the arteries. Okay. So if our blood vessels are here, everything passes through nice and smooth. If it's hard in the arteries, well, then they can't open and close and allow the blood through as properly. Okay, if the arteries are hard, well, then they can't open and expand, and that increases our blood pressure. Okay, so if you ever heard that term, arterial sclerosis, that's actually a hardening of the linings of the blood vessels. And now they can't expand and they're not as elastic as they were before. So that creates greater pressure inside if they're not as elastic. Okay, vasculitis. Okay, anything vascular involves circulation. Okay, so vasculitis involves inflammation within the circulation system or within the blood vessels. Okay, and if there's inflammation, if these are your blood vessels, things flowing in between, if there's inflammation, well, there's less room in between because these are all inflamed and puffy, and maybe not as much blood can go through, or maybe it's causing greater pressure against the blood vessels. Okay. All right. And there's also different things that could happen with your heart or your aorta. So we're not going to get into some of these scarier medical problems. We're going to talk about things that we have a little more control over. Okay. So I did mention different things that involved arterial sclerosis or vasculitis. Also, people that have problems with their kidneys. Okay, remember I said kidneys help regulate and clear out fluids from your body. So anybody has a problem with their kidneys, there could be a chance that you're at risk for high blood pressure also. So anything with kidneys, I'll let you know, kidneys, when they work or they're working hard, they kind of release some chemicals like renin. And what that does is it actually creates storage of water. Okay? And the more water we have in our body, well, the more blood pressure we have. Okay, if there's more water in the garden hose, well, then there's more pressure in the garden hose. Okay, so keep that in mind where we're talking about risk factors. So I'll mention that. Those of us that are like greatly hydrated, okay? So if you got a lot of fluid in your body, there's more chance of higher blood pressure. Also, if you have a greater surface area, okay, like the bigger you are, well, the greater area of skin and body that I have. So the greater surface area that you have in your body, well, then your heart has to pump harder to get blood to all those different places in your body. Okay, so the greater your surface area, yeah, you're a little more at risk for high blood pressure. Okay. Who else? Well, people like me. I don't know how you're seeing with your colors out there, but like different ethnicities are actually more prone to high blood pressure. And like I'm a little darker skinned, so a lot of people that are darker skinned, or like of African descent or Southern Asian descent, they're actually a little more prone to high blood pressure. So like people with darker skin tones are more prone to high blood pressure. Sometimes people take medications. Maybe even their doctor prescribe them, but their medications make them store fluid or makes them more prone to high blood pressure. Okay? I will let you know, all right, like not so happy about it, but people also like me, men, okay? Men are more prone to high blood pressure than women. And there's different factors involved in that. But like there's another risk factor, like your sex. Your body size, your ethnicity, your medical history. What about your genetics? Okay, if someone in your family has like high blood pressure in their history, there's a better chance that you may also have high blood pressure in your genes and the things that you inherited from mom and dad and grandma and grandpa and stuff like that. Okay, so keep that in mind. And maybe some of you see that on medical forms. They ask you, like, perhaps how did different people in your family pass, or do they have different health histories? And sometimes if we see, like different things in your genetics, well, maybe that helps the doctor or other professionals look after you better. Okay, if they understand what you're going through, oh, look, grandma, grandpa had high blood pressure. Well, there could be a chance that Dan has, more of a risk to have high blood pressure. Okay, and I will let you know, and there's good news coming up. But like just because our genes and stuff say that I may be more prone to having high blood pressure, doesn't mean I have to. Okay, but I'll get into that now. I'll tell you a little more about that as we go here. Okay, so I'm going to move on a bit here, and I'm going to talk about different things that actually put us at risk for high blood pressure. Okay, so I got a whole bunch of like holdups here for you. So I'm going to bring them up there so you can see. And you can take notes, and like I'm going to talk about each different category. I got 2 per page here. And let's take a look at the things that make you more at risk to having high blood pressure or hypertension. Okay. How we see that? High salt intake. Okay. So if you have a high salt intake or a high salt consumption, that actually increases your blood pressure. So some of you may be aware that salt actually attracts water. So if I have more salt in my body and I'm eating a lot of salt in my diet, my body is actually going to hold on to a lot more water. And if I'm holding on to a lot more water, well, I'm juicier. I have a higher blood pressure. Okay. So what are some of the things that increase our salt intake? Well, different types of foods. Okay. And most of us actually get 10 to 15 times more salt in our daily diet than we even need. Okay? And having a high salt diet actually increases your chance of high blood pressure or hypertension by 20 to 40%. Okay? Salt attracts fluid into our kidneys. And remember I said when our kidneys have more fluid, well, then we got more fluid in our body. Okay? There is a recommendation. So Health Canada recommends for your salt intake that we have less than 2,300 milligrams per day. Okay, and we can look at that on different labels. Okay, like if you're a label reader, just kind of take a peek on the back of your packages and stuff and see how much sodium is in there. Okay. And make sure if it tells you how much sodium there is, like for a tablespoon or a quarter cup or something, make sure you do the calculations. Like if you're going to use 2 tablespoons of that, make sure you double up what it says for sodium so you have a more accurate record of what you're taking in for sodium in the day. Okay. But us as like regular adults, less than 2,300 milligrams of sodium per day. Okay. Also on my page here. Can you see there? Age. Right. So as we age, it is natural for your blood vessels to get more firm and less elastic. Okay, as we age, like as a rubber band ages, well, it's less elastic. Same for our blood vessels. Okay, not happy about it, but it's going to happen. So there's a natural arterial sclerosis or a hardening of the arteries as we age. Okay, we can slow that down. We can make them more elastic from our diet, having more healthy fats, exercising, so the blood vessels are moving around, so they don't get a chance to get so stiff. Okay, but people over 75 years of age and over probably are at two-thirds of those people, okay, already at risk for arteriosclerosis, okay, hardening of our arteries. So if you're over 75, two-thirds of the people over age 75 are already at risk for arteriosclerosis or hardening of the arteries. Okay, there's different things we can do. By age 60, you're probably 90% risk chance of your arteries starting to harden. So let's stay active. We're going to talk about some different foods that help your blood vessels and stuff like that. But if our blood vessels don't get so hard, okay, and they're more elastic, that they can like flow when blood's pumping through there, okay, then we don't have so high blood pressure. And maybe we regulate our blood pressure rather than getting into hypertensive areas. Okay, all right, got lots more for you. That was the first two. Okay, next. Alcohol consumption. So there was a recent study in Japan, okay, because those are some of the ones that they can monitor alcohol a little better than us in North America. But there was a recent study in Japan, and it said with a regular or a higher alcohol consumption, that the risk for hypertension or increased blood pressure for men increased by 34.5%. For women, 2.6%, but they have different drinking standards. I don't know if you're familiar, but a lot of Japanese businessmen go out and drink right after work and stuff like that. Or at least what they show on TV. Okay, all right, but alcohol consumption is going to increase our chance of being hypertensive. It actually hardens the arteries a bit. Okay, it stiffens up that elasticity. Okay, so our blood vessels aren't so elastic. Sometimes, well, if you're drinking, it could make your heart beat in different ways. Okay, now if your heart's beating strong or pumping out a lot, well, that's going to increase blood pressure also. Okay, so I mentioned alcohol consumption. All right, family history. Oh, there we are. There we are. Family history of high blood pressure. Okay. So, family history, well, those are people we grew up with. Maybe it's genetics. Maybe we grew up in the same environment. So we've all been exposed to the same common environmental factors. There's genetic factors. What if, my family history, we don't exercise so much. Okay, that could come down. Or if, my family is, bigger people or higher blood pressure or darker skin, well, I inherited that too. Okay, so anything in my family history that had increased blood pressure risks could be a chance I inherited that. Okay, but there's also some good news too. Okay, so even if you have a family history of high blood pressure, the people that exercise on a regular basis, so even if my family has high blood pressure, if I exercise on a regular basis, I already have about 35% less chance of having their high blood pressure. Okay, so we can actually change things generationally. Okay, maybe we change, the health of our family over time. Maybe we change the amount of body fat our family has over time. Maybe we change the amount of health risks. Okay, whether it be cardiac, blood pressure, diabetes, stuff like that, that our family has over time. So there could be a chance that we get healthier. Well, maybe we're going to pass on those healthier genetics, and over time our bloodline, our family is going to get healthier. Okay. So don't think that even if you're at risk, okay, because of mom, dad, grandparents, stuff like that, that we can't change that. So, if you stay active, even if mom and dad had high blood pressure, you stay active, you already got a 35% less chance of having high blood pressure than they did. That's good news. I'm ready to move on. That's good news. But since we're talking about family history, then let me pop up this one. Gotta make sure you can see. Obesity. Okay. So obesity happens, at different times. Maybe we have a sedentary lifestyle. Maybe we have a very unhealthy diet. Could be a chance that we have high sodium or high salt in our diet. Okay. What obesity is going to do? It's going to thicken those arteries. Okay. So once again, there's more pressure because they're not so elastic. Right. Well, obesity, well, wouldn't that create a greater surface area on our body? So the greater amount of skin and surface area we have, well, there's another risk for higher blood pressure. Obesity means that we have a BMI or a body mass index of over 30. Okay, we're not going to talk too much about BMI, but BMI is based on height and weight and its average, risk factors. So, someone who's obese, their BMI is perhaps over 30, and that immediately puts them at different risk factors. Okay, maybe it be with their joints, maybe it be with their heart, maybe it be with diabetes and blood pressure. Okay, so anybody in the obese range, and obesity is something that the doctor, okay, measures and tells you. Okay, so they do different measurements on you. Maybe do weight, maybe do calipers and check fat and stuff like that. Maybe they do your BMI, right? But they check into different things, and obesity is truly a medical diagnosis. So once you get to the point of obesity, we're actually in the risk of medical stuff. And one of those medical things is definitely high blood pressure. Okay, different things that can help keep down obesity, okay, or bring our BMI down so we have less body fat perhaps on our body. Well, higher protein diets, lower processed food, okay, different things like nuts, full grains, vegetables, fish, lean meats, but different things like that will help maintain our weight, and perhaps we don't take our body into the range of obesity, which is a medical concern, and there's different medical things involved after your body fat perhaps has gone into a risky range. Okay, and definitely high blood pressure is in there. Some of you may be aware of that already. Okay, so also down after obesity, you see I got back here, lack of exercise. So when we exercise, well, we exercise, that usually increases your heart rate, okay, and that helps circulation through the body. And if you exercise on a regular basis, we can actually bring down your blood pressure by like 6 to 8 points, okay, or 6 to 8 milligrams of mercury from that silvery thermometer thing, okay, or the sphygmatometer is that blood pressure cuff machine, okay. But we do need to exercise about 25 to 30 minutes every day to get benefits. And you choose your exercise, okay? Of course, good exercise for the heart include swimming, cycling, walking, but strength exercises are good also, okay, and will help regulate your blood pressure. But the more your body is used to exercise, the more it's used to blood flowing through to the muscles. Well, then maybe those blood vessels are getting used to taking blood flow comfortably back and forth, and they're not all stiff and get high blood pressure. Okay? Even though exercise is a good thing, remember I said it's got to be on a regular basis. So we still want to stay active, like 25 to 30 minutes every day. At least to the point that you feel, like perhaps a little challenge, or maybe, like some of us feel a little winded, like huffy puffy. Okay, not short of breath, but just feeling that you're challenging your heart and your movements and stuff like that. 25 to 30 minutes. Do it regularly, but if you do it sporadically, like, okay, I work hard over here, I exercise hard, I wait a few days, I sit on my butt, and then another day I go and I work out really hard. Okay, that could be hard on your heart and your blood pressure. So if you're only working out a little here and a little there, or hard here, hard there, well, if there's a long time in between, that could be hard on your heart and your blood pressure. So if we do it regularly, well, then maybe our blood flow learns to be more regulated as we exercise and we rest. Okay. So, get out there, move around 25 to 30 minutes every day, feel a little glow on or that. Don't strain yourself. Take a bunch of water. It's hot out there. All right. But keep yourself moving. All right. Moving on. Other things that are risk factors for us. Okay. Some of you may already know this. Stress. So any type of emotional tension puts stress on our blood vessels. Yeah. Signs and symptoms of stress. Okay, maybe we got to recognize stress. Some of us don't even know that we're stressed. So we could have headaches or dizziness. Maybe we have a loss of thought or clarity. Maybe compulsive eating, okay, or forgetfulness. Maybe we're angry or irritable. Urgh. Or we do things impulsively, like different impulsive actions, or we're nervous, or we're sad. Okay, so different things, create emotional tension in our body, and any type of emotional tension in our body increases blood pressure. Okay? So, we live in a very fast-paced and demanding world at times. I do realize, well, we'll talk about some things, but make sure you find something that you enjoy, that causes you to, relax, even if it's just sitting on your butt in the shade for a little bit. Okay, I did that the other day. I went hiking around, but oh, it was so nice to sit in the shade and the breeze. Okay, so do things that you enjoy, and maybe we can keep our blood pressure down in this stressful and fast-paced work. Okay, all right. Other things in the world. Smoking. Okay, whether you're the one smoking or maybe someone in the house is smoking. Okay, and you get secondhand smoke. So any type of ingestion of smoke, whether it be you're the smoker or passive secondhand smoke, well, that can increase our blood pressure. Okay, and smoking, like in cigarettes, it's not just plain tobacco. There's different chemicals in there. Okay, so it burns at a certain rate. Maybe it smells or tastes a certain way. Okay, maybe it lasts, so there's a no bugs eating the tobacco and stuff like that. But there's lots of different chemicals, and those chemicals, like in a cigarette, can actually damage the walls in your arteries. They make them thinner. Okay, and they mentioned before in studies that's usually the higher risk is people that have like 15 or more cigarettes a day. I don't know if you know, in high school I used to smoke, but I don't even think I could smoke 15 a day. That seems like a lot. Okay? For me, if you can, just cut down all smoking or cease smoking. Okay? Even remove yourself, sit away from secondhand smoke. Okay? Not only can it increase blood pressure, it could create heart complications. And even if you stop smoking, okay, I stopped smoking, your blood vessels are actually hard for a prolonged period after you stop smoking. Okay, so you set the cigarettes down. Well, still, my blood vessels are going to be hard. It takes them a while to heal up again. All right, and so they can get loose and they're nice and elastic and pliable to allow blood to pump and flow freely. Okay, two more risk factors. Hey, sleep apnea. Okay, sleep apnea is any time that your breathing is disturbed while you're sleeping. Okay. If your breathing's disturbed, the oxygen in your blood drops drastically, and that puts a strain on your heart. And if your heart is strained, your blood pressure goes up. So who's prone to sleep apnea? Bugger. Men, those over 40, and also obese people. Okay. Those are people at higher risk for problems with their breathing while they sleep. Okay. If left untreated, well, yes, you could have hypertension or high blood pressure in your history. And if it goes on for a long time, some people actually have heart failure. Okay, if they can't breathe properly at night. And not to scare any of you. Okay. But when I worked on different cardiac floors, one of the highest risk times for people to have a heart attack is probably around 4 in the morning. Okay. Well, there's different factors that could happen there, but one of those things could be sleep apnea when you're very deep into sleep and perhaps there's some disturbance in your breathing. But that's one of the highest times where people have heart attack is early morning, like 4 o'clock in the morning. All right, one last thing. Other medical conditions. Okay. So different other medical conditions or different meds that you're taking, different things like birth control pills, certain medications, okay, high caffeine in your diet, that could affect your heart rate. People that have chronic kidney diseases or thyroid problems, okay? Different medical conditions can also increase your blood pressure to bring you into hypertension. Okay. If those things go over time, that could possibly lead to depression if you got long-standing illness. And depression, well, that also increases blood pressure. Okay. It affects people's ability to perform. They have behavioral problems, perhaps. And sometimes, when people have different behavioral problems, some people take amphetamines. And well, maybe the doctor gave you that. But even for some of those problems, amphetamines can increase your blood pressure. So keep in mind, even though maybe we're trying to look after different things in our health, there could be some things that we're taking, whether doctor recommended or we're just trying to stay healthy on our own, that could increase our blood pressure. Okay, hypertension. So keep those things in mind. Okay. Hey, I'm going to take a little breather here. I'm going to take a peek and see if we have any questions on there, or if Heather wants to pop up with anything.
Hello. Um,
Hello.
so we've got one question here,
Okay.
and it's how do you balance hydration during a heat wave, with not upping your blood pressure?
Truly in the heat wave, for most part, we're probably getting dehydrated. So one of the things that you still have to stay hydrated, keep things nice and clear. Don't have too much sugar or caffeine. High sugar, high caffeine will actually decrease the amount of hydration in the body because it'll pull fluid from the body. So you should actually be drinking enough that when you go to the bathroom, when you go pee, it should be almost lightly straw colored. Okay, if it starts to get darker in that, well, you're starting to get dehydrated. Things are starting to get concentrated in the pee-pee area. Okay,
Mhm.
so make sure you're drinking enough that when you go to the bathroom, and you should be going to the bathroom, like water should be flowing through you. All right, make sure that things are light and straw colored. And one more thing, and I'll just let you know a little thing that we do in the hospital at times. I'm going to show you my hand here. So you give your hand a little pinch. See how I'm pinching up the skin? Watch. Did you see how it snapped back? Okay. So another thing that we do in the hospital to see if people are getting dehydrated, if you pinch up the skin on the back of your hand and it stays up there, that's actually called tenting. And that means that the tissues are getting dry, like you're losing fluid in between the tissues and they stick up there. Okay. Maybe some of you can do that right now. Give the back of your hand a little pinch and see, does it snap back flat or did it stay up for a few moments? Okay. If it stays up for a few moments, you're starting to get a little dry. Okay. So you always want the tissues in your body to snap back like a cat. Right. So drink up, make sure things snap back gently and pass nice, clear fluid.
All right, we got one more.
Okay.
If you haven't already been diagnosed, what are some of the warning signs that you should be aware of, and then go and see your doctor?
Diagnosed with what? Did they mention
Hypertension.
hypertension?
Yeah, what are the, I guess, the signs and symptoms that you should be aware of?
Some people can actually see hypertension. Okay. Some people, anybody ever see like a little vein? All right. Some people can actually see hypertension, or they have like a blood vessel in their neck. But otherwise, make sure you check with your doc. Even every now and then, like sometimes they have it in the shopping centers where you sit there and you get the cuff on your arm and they check your blood pressure. Okay, remember we said 120 over 80 is around average. I don't know if you can see back there behind me, but like if you're getting out of that range, maybe it's time to go see doctor. Other things that we actually could feel with higher blood pressure, some people actually feel a little palpitation. Some people get headaches because like the pressure is building up and like it makes the blood vessels bigger up here and they can actually feel it. Okay, they get headaches or dizzy, or maybe they have a little confusion or problem solving gets a little difficult. Okay, but if you suspect it, maybe it's time for a little checkup.
Okay, we did have one that just popped up. It says they drink a lot of water, but the urine is still dark.
Okay, check with doc. Okay, try different things, but also a dark urine could possibly from diet. Okay, there's different things that we have in our diet. Sometimes it's fatty or greasier food, maybe even like a asparagus or different types of vegetables could change the color and like sometimes even the scent of what we pee out. But yeah, make sure you're drinking stuff, like clear, fresh water is the best thing. Okay, not too much sugar or caffeine. And if you're still concerned about the passage, maybe doctor has to check out a little sample or something, just to make sure that kidneys are pushing out what they need to.
Perfect. I think we're good. You want to keep going?
I'm good.
All right.
Let's move on. I've got some things I just want to make sure that we get through today. Okay. All right. Thank you so much for the questions. We'll get back to a few more. Maybe some of you can send me some chatty stuff. But yeah, I'm going to go through quickly. We're going to go through a bunch of foods that put you at risk for higher blood pressure. And then I got another list that will help bring down.